bacteria in your horse, you're going to have a healthy horse. It's really simple. So it can be difficult to get those healthy bacteria once they've lost them. So once they've had an insult to their bowel or their lifestyle or feeding change that causes that hindgut bowel fermentation process to go out of whack and go stupid, it can be very difficult in some horses just by feeding them or giving them those other two products to get normal bacteria in there. So what we try and do, which is with some success, is we give them healthy bacteria from a healthy horse. So we take poo from a healthy horse that doesn't have hindgut acidosis, and we give that to a horse that does florid tubes. So we drench them with poo. As horrible as it sounds, again, those bacteria and organisms face a similar challenge of trying to get through the digestion process and so in the stomach and into the large bowel area. And in manure, in poo, there's not a great number of great live bacteria. A lot of the bacteria are dead and by the time they come, but there's obviously some. So it's a crude way of getting some bacteria and healthy bacteria into the bowel. Another little bit more effective way is to take gut contents. So don't take the manure of the horse, go inside a dead horse that was healthy and open their guts up and take their digestion products out. So what's the fermentation that's in the large bowel, the food that's being digested, and then drench that into the horse. We do that sometimes. It's difficult to do because you don't always have access to a dead horse, and it's a big drama to try and find a dead horse that's just been killed that was healthy and take their gut contents and put it into another horse. So, but it can be done, and we do that sometimes. Fecal repopulation is part of the treatment. So, but basically, once you've been diagnosed with a suspicion of hindgut acidosis or an upset in your horse's hindgut, then the feeding of fibre and is the key thing, and low sugar. So we often do a diet analysis, and then we change them over with the fecal testing as well. Trying to reduce the amount of sugar by changing. This would be like a laminitis grazing strategy that are horses that are susceptible to laminitis with the high sugars. These are horses that don't have laminitis, they've got hindgut disease, different pathology, different disease, but we believe starch is a problem with upsetting the bowel in the first place. So again, we tend to graze them strategically during the day when the sugars on the pasture are at their lowest. Okay? So that's one of the strategies we use with these horses. We also, if you're going to feed grains, we like the grains that are well cooked for these horses, not so much for gastric ulcer horses, but for hindgut horses, we like the ones that have been extruded. So extruded feeds, Thompson Redwood make good quality extruded feeds. There are lots of different brands, but you want ones that are cooked well. The better they're cooked, and that partially digests those grains, which makes them more absorbable in the foregut. So in the small intestine, the horse will absorb those so they don't get through to the large bowel. Feeding small meals and small amounts of grain. Again, very similar feeding strategy for stomach ulcers and for hindgut acidosis. Trying to feed things like beet pulp. We find beet pulp is very effective for these hindgut horses. Doesn't seem to make much difference in gastric ulcer horses, but hindgut horses, hindgut ulcer horses, hindgut acidosis horses, beet pulp seems to be a very good effective food to help protect and help re-establish a normal microbiome there. So that's what you want your horse's manure to look like. So what else can manure tell us? Well, it's a window to assess the gut health of your horse, okay? And so just some little facts here. Each passing should be about 15 seconds long. It'll change depending on whether you're a mare or a gelding, how often you go and how old you are and what you're eating. But basically there should be lots of it. As we all know, cleaning out stables and cleaning up paddocks. Your average horse should produce about 20 kilograms of poo a day. You should try and get to know what the normal smell and consistency and colour is, although of course it will change according to the seasons and pasture and what you're feeding the horse. one of the things that's really important to look at your horse manure is the fibre length. So when you see the chewed up hay stalk in your horse's manure, if it's longer than how much, Derek? 8 millimetres, 10 millimetres?
10.
10. If it's longer than 10 millimetres long, 1 centimetre long, that means your horse isn't chewing it properly. Then he can't digest it properly. Those bacteria in the hindgut cannot digest large length fibre grass. They can only digest small lengths, less than a centimetre. So don't have teeth, you're going to get hindgut problems, and you're not going to put on weight. And that's one of the reasons that food just goes straight through them. They can't chew it, so it goes straight through. They can't ferment it, it goes straight through them. So look at your fibre length in your manure. Derek will probably tell you whether your horse has got teeth problems or chewing problems. Even if it's not quitting or dropping food, just by looking at the horse's manure. If that fibre length is too long in a majority of the fecal bowls, then we know they're not chewing their food properly. We can sometimes see parasites and visible worms, but remember, you're probably not going to see bots. You certainly won't see the eggs of the worms that we're going to look for in small strongyles, and Sue will talk about that. You'll see sand in horses that are full of sand, and of course that's a very common problem in West Australian horses. But you should very rarely see blood. The test that we use to check for blood is for traces amounts of blood. You shouldn't see whole blood, certainly not coming from the bowel. So let's talk a little bit about loose manure and diarrhoea. These are the 5 common causes of loose manure and diarrhoea, and fortunately the first 3, infectious causes like salmonella or food poisoning, and inflammatory and cancerous causes, they're fortunately very, very rare. We do see some lymphoma, which is a blood cancer that causes bowel problems in older horses, and that causes through diarrhoea is one of the first signs of that. Inflammatory diseases in horses are very rare, and in WA we don't have too much salmonella or clostridia, but of course, like everywhere else, we get parasites. And parasites, which Sue will talk about a bit more, are becoming a re-emerging disease because of resistance. Most of our diarrhoea or loose manure horses are not sick horses unless they have sand, and the sand irritates them, and their diarrhoea is management related, so diet related and feeding changes related, and it's often just transient and you don't need much to worry about much. Here's just an abdominal x-ray of a horse's abdomen, and with sand. So you can see sand here, a viscous of sand in the ventral abdomen here in this horse, and another one there. And so gravity sort of sits it in the lower part of the bowel, and that will irritate the bowel, and both these horses had diarrhoea from the sand. Curiously, you give them a drench to give them more diarrhoea to force the sand out, and then the diarrhoea stops. Again, a very crude treatment for a crude problem, a sand irritation. These are not impacted horses. They're not horses that are blocked up, and they're not necessarily colicky horses. They've just got diarrhoea. So I have a saying that the 4 common causes of diarrhoea in horses are sand, 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 and sand. WA. Okay? And that holds true. But we do see this syndrome, which I'll talk a little bit about. Some of you may have seen this, which no one really has a name for it, but I call it the dirty bottom syndrome, because that's what it causes. We have well horses that, for all intents and purposes, you think there's nothing wrong with. They're out showing, they're out jumping, they're out competing, they're out being bred. There's nothing wrong with them. They're not on medication. They're perfectly happy horses. But their owners aren't very happy because their bottom's dirty all the time, and they're having to clean their rugs all the time, wipe their back ends off at the show because they're staining the backs of their legs, and they've got this sort of dribble dirty tail, and it's a management problem. And we think, well, they've got an upset tummy, irritated tummy. They try 11 different herbs and spices in their feed to try and stop it, and nothing seems to work. Nothing. Sometimes it goes and then comes back again, and so it can be episodic. But sometimes it's all the time. A lot of times it's worse during transport. So you take your horse to the show with a clean tail and you get it off the float, and it's got a mess everywhere. And it didn't have diarrhoea before it got on the float, so why has it got diarrhoea now? So we get this a normal motion, then right at the end of the motion we get this dribble of juice that we shouldn't get. And so we get this post-motion dribble. And in very severe cases, again, severe in inverted commas, we'll sometimes see some irritated skin around the bottom. And the manure smells. I mean, it's not a normal smelling manure. The connoisseurs of manure smell. they're not like this. This is a horse with Clostridial enteritis or colitis. It's got severe diarrhea and it will probably die. It'll dehydrate to death from a lack of the ability to conserve water through its compromised bowel. So when you see these diarrhea horses, and I've just said to you the 4 common causes in diarrhea in horses are sand, 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 and sand in WA. You know, we've drenched them, we've x-rayed them, and we've tested their faeces for sand, haven't found it. They don't have worms. They've got good worming history. We test them here, they don't have worms. They're not sick, they're eating well, they're not ulcer, their pH is normal. It doesn't matter what the owners feed them, they change diets and they try everything, it doesn't make any difference. And no other horse has it in the stable. It's not like it comes and a few horses get it and they go. And there's no seasonality to it. So we rule all those out and we're left with an unknown cause, which people just say, well, it's normal for this horse. Well, it's not normal, in my view. It shouldn't be normal. And I can prove it in most horses by treating them. I don't know what I'm treating and I don't know why it works, but it does in most horses. We don't know the causes, but certainly those horses that get worse during transport and stress times, we believe that's probably related to adrenaline release and hypermotility of the bowel, especially when you're transporting horses to a show. They get butterflies like the riders do, and they get a bit upset and transient diarrhea. There is this theory that people smarter than me have, that there's probably an organism that these horses have that we haven't been able to identify. So similar to your Helicobacter story, until we identified Helicobacter in people. They're trying to culture and sample the horses with this disease. They're not common horses, but this is what they look like, dirty bottoms. They're their kids are riding them at Pony Club and they've just got a dirty bottom all the time. So it's a disease of the hindgut that we've yet to determine what the cause of it is. I subscribe to the infectious bacteria or some organism causing the problem. And the reason why I subscribe to that, and people smarter than me do, but some smarter than me don't. So my word is not gospel on this, but I treat these as though they're sick, as though they've got an infection. And when I do that, I give them a course of, I put them on a very bland diet, so a low sugar diet, so that I remove that starch substrate that might, we know, encourages the proliferation of bad bacteria, whatever they are. And I think this is a bad bacteria in the bowel. It's just irritating the bowel. And then I give them a 5 to 10 day course, and usually 10 days a prolonged course of antibiotics. And they often stop having that diarrhea. It's not really diarrhea, but it's dribble. And if you then take them off the antibiotics, it then often returns. So what we do with those horses is now is we give them the antibiotics, sometimes, as I said, 10 days, even sometimes up to 3 weeks, and either use a sulfur-based one or another product called metronidazole. Is we then, 2 days after the antibiotics is finished, we give them a series of drenches of poo of healthy bacteria. So my theory with these horses is to wipe out the bacterial population, good and bad in a sense, to really suppress it with the antibiotics and the metronidazole, and then quickly as you can repopulate the bowel with some healthy bacteria. And I would say I've had success with 60-70% of cases. And the best one was my mum's horse, who bought a show pony that had a dirty ass all the time, and it had done before she bought it. The people said, when you take it to a show and show it, you'll have to take sponges with you in a bucket and follow it around there because it'll have diarrhea all the time, and every time it has a poo, it'll make a mess of itself rather than a nice, clean, healthy poo. So it needs its bottom wiped all the time. And she lived with that for 6 months until she told me what was going on. I said, well, that's not normal. Your pony shouldn't be doing it. No, it's always done that. The previous people had it and the people before them had it. I said, no, I don't think it's normal. Can we try and treat this horse? And I did this with her horse, and I've done with many others, and never did it again. So I completely fixed it. But I haven't fixed every horse that's had this problem. But if you're sitting here and you think, I've got a horse like that, it's worth trying to rule out some of those other things, because most of them are not this dirty body syndrome. They're sand, or they're worms, or they're something else. But there is a small group of horses that are what I call well. They don't have sands, they don't have worms, they don't have anything else funny going on. They're very well looked after, but they've got this dirty bottom. And I don't think you should live with it because I've seen it change in horses that I've treated with this program. It's not published, it's not scientific, it's not proven. However, there are many vets that are doing this and are following, and where we talk outside of the literature, and myself and Guy Lester at the university, the gastroenterologist down there, he uses a very similar program with these horses, and we both believe we're having success. We don't really know why. We don't know what bacteria we're treating. We don't know why they've got this bacteria, if it is a bacteria that we're killing. And we don't know, is it the antibiotics more important than the change in diet and the fecal drenches? Maybe it's just the fecal drenches. But I have tried just fecal drenching them, haven't had as good a result. I've just tried giving them antibiotics and then not repopulating them, and I haven't had as good a result. So I now do both, and we get quite a few horses now referred to us for this treatment, and we get mostly smiling faces. It's not a terribly expensive treatment, it's not a terribly difficult treatment, it's all oral medication, and apart from the metronidazole, which might make your horse go off food, so I don't routinely use that, only in some cases will I use metronidazole. It's a very safe way to go, and people, if you get a good result, well, you're nothing ventured, nothing gained. So that's it. I'm going to shut up now. We're going to have a, Nutty, we're having a break now. People stretch their legs, have a coffee. I'll take one question. So my opinion on probiotic supplement. We're not big users of it in our practice. I don't think they do any harm, but I'm sceptical about what they're supposed to achieve, and whether they, whether you really get those bacteria that have been sitting on a shelf in a supplement in a feed store for a powder or for a couple of months, whether they're fresh enough or active enough. There's just no good peer-reviewed research or studies that show that they do anything more than empty your wallet. However, anecdotally, people think that they make a difference. There's been some interesting research on probiotics in people, because there's a big push. You see adverts on your TV every night to take probiotics, and all these little cartoony type characters that are swimming around your gut. And the latest research that's coming out of the American Medical Association is that it's all just complete rubbish.
The Americans don't look well, do they?
Sorry?
The Americans don't look well.
The literature now is saying that probiotics in humans are a scam. They do not do anything. So who knows? I don't know. I'm not yet decided. But in horses, I struggle with it because I'm not convinced that the amount that we give in the way that we give it makes any sense to achieving what it's supposed to be doing. So that's just my view. There might be some vets who like it, but I think there are other ways of going about it.